when we look at the guidelines based on the KEYNOTE-564 trial, and so we should consider to apply adjuvant pembrolizumab first. But sometimes our patients may have some autoimmune disease previously. So we have to consider that those patients might prone to immune-related adverse events under the pembrolizumab treatment. So we have to take into account these conditions before starting therapy. This is very important in our clinical daily practice, because this is the first trial that showed improved overall survival in the setting in the adjuvant treatment of clear cell RCC. This is very important. And on the other hand, we should evaluate our patients according to their risk groups, and if they have intermediate high or high risk disease, and we have to consider to give our patients pembrolizumab in the adjuvant setting. So yeah, especially, and I would like to mention about maybe we can elaborate the risk groups, intermediate high risk or high risk disease. And so if a patient has T2 grade 4 or sarcomatoid disease, and also T3 disease, and we can classify this patient as intermediate high risk. And if a patient has T4 and also not positive disease, we can classify this patient as a high risk disease. On the other hand, in metastatic setting and after metastasectomy, if there is no evidence of disease, and we also should consider to give adjuvant pembrolizumab in our patients.